Hi, everyone, and welcome back to another episode of the Silvatis podcast. This week, I've got Louise Carruthers, who is an osteopath, joining me, and we're going to be talking about all things pregnancy related and pediatric osteopathy. So, welcome, Louise. Thanks for joining me today.
Hiya.
How are you today?
Yeah, I'm good. I'm good.
Yeah.
Yeah, how are you?
Good. Yeah, I'm really excited to talk to you because obviously we know each other from when we were both at BCom. So
Mhm.
you were my clinic tutor at the time, and now we're colleagues
Yay.
and
'Cause
friends.
yeah, I hope so. Because you're teaching now at BCom too, aren't you?
I am, yeah.
Yeah.
And you all made it look so easy.
Well, it kind of is. When you've got a nice bunch of students, it just kind of flows. And it's an extension of what we do every day anyway. Because
Yeah.
everybody that works there, apart from the admin team, and maybe even some of the admin team, we're all osteopaths day to day.
Yeah. And what made you get into teaching?
It just I think I always wanted to be a teacher. Even before I studied osteopathy, it was a choice between, do I go off and study biology or do I study osteopathy? And I kind of, I think it was not a case of whether I was going to do it. It was more a case of when. Because I was very young when I trained to be an osteopath. I graduated, I think, at the age of maybe 22, 23. Um, and we had such a mix of students in there. I kind of wanted to get a bit of life under my belt before I came and back to teaching.
And so what influenced you? So you must have come straight from school then into
Hmm.
osteopathy. And so what made you want to choose osteopathy as a degree and even as a career?
I kind of fell into it without sounding too strange. I mean, my one of my sisters was a young baby when she saw an osteopath, and I hope she's allowing me to say that. And my other sister saw quite a few physios and osteopaths in her teens. I did for migraines when I was in my teens, and it really helped. And the idea that you know the idea that it could help, and that the body heals itself, and it just at the time it made sense. And I love the fact that every day is different. You're getting to meet all of these wonderful people, both colleagues and patients. And you know what? A clinic day is what you make of it. It could either be, feeling bored and seeing, just in your mind, seeing backs all day, every day, or you can go, well, actually, this person's got this back pain and there's this reason, and maybe there's that reason. And how are they responding to treatment? Is there something I'm missing? There's always something to learn.
And you talked about coming back and wanting to get some more life experience under your belt. So
Mm.
for me, it's quite different because I came into it as a second career.
Mhm.
What did you feel you needed when you finished or graduated from BCom?
I think in terms of life experience, it was more a case of how to communicate and handle patients and different expectations, because that hasn't always been a strong suit of mine. Um, and also just to get out and learn and experience. And I worked in quite a few different types of practices through the years, from working in lone practice to being in big group practice to being in multidisciplinary practice. And it, I think that really helped me in talking to the students and talking to the patients. I also went and did an extra degree before coming back. I did a teaching qualification before I came back to teach as well, because it was a really kind of strange turning point when I was doing my degree, because the year before us got a BSc, our year got a BOst Med, and then the following year they all got masters. So I then made the decision that I wanted at least the same qualification as you guys, if not more, which in hindsight is quite silly because, I at that stage I had, I think, 9 years in practice. So yeah.
Wow.
But one of the best things is I got to graduate with one of my best friends.
Oh,
So
that's sweet.
her with her undergrad and me with my postgrad.
And what was it like? Because not a lot of, at least not a lot of tutors that I know, have educational sort of degrees
Mm.
to teach. How has that shaped the way you approach your teaching style?
I think it has made me really think about um, feedback in particular. I am terrible at um, looking at myself. I find that a very painful process, actually, looking at negative aspects and how I can improve. And it's really helped, particularly because at BCom you have to give so much feedback. So much feedback, I didn't realize. And actually, the team are really great. I'm really lucky with Gemma because quite often I'll go to her and I'll be like, Gemma, I really want to say this and I really want to phrase it like this, but I don't. I actually have had this conversation, by the way. I really don't want it to say it in a way that the student's either going to switch off or they're not going to be able to take that constructively, or that I'm just going to sound really harsh, or that I'm just being too nice. But Gemma's really good at helping me phrase things, especially at the beginning.
Yeah, and she's been at it for so long as well. She's a pro at this point.
Oh, she's an epic manager, you know. She really is. Yeah.
Yeah. And so coming away from teaching then,
Mm,
you talked about sort of working in different types of practices,
mm,
and you talked about working at a multidisciplinary practice.
yeah.
Now, I've not been out there as long, so having come in from a different career, I can
Mm.
imagine that's got a new or a different dynamic to the whole way the maybe the office operates. What's it like? What was it like for you working an MDT approach?
Um, it was really refreshing because I've worked in a chiropractic clinic and their approach is quite different, although we all do a fairly similar job. I mean, they were very good chiropractors, and they were nice people, but they were a lot more business minded, I think. Whereas I mean, they are patient led and it's patient centered care. Anyway, yeah, I'm. I think maybe I'm not the right kind of person to come in and run a business. And the other clinic I worked at is I worked in a clinic where I was the only osteopath for a while, with physio, acupuncturist who was also a nurse, um, Pilates, yoga, sports massage, beauty, you name it. But everybody had something different to say and something different to learn from. I certainly learned a lot from the Pilates and yoga. I certainly learnt a lot from my physio colleagues. Um, we all ended up very good friends, actually, I like to think. Um, but it just kind of shows that there are different perspectives, you know. Osteopathy is a great approach, but it's not always the approach, you know. And even within the same profession, we all work slightly differently, you know, whether or not that's to compensate for something that's going on with the patient or with our own bodies, or there's a specific style that we like to work in. It all varies so much. I think my practice changes, you know, month by month.
Well, that's one thing that interests me is how has your practice evolved since you graduated and then started teaching and you continue to practice?
Oh, massively, massively. I kind of think palpation skills have changed a lot. particularly in the last few years. So I've been in practice now for 12 years. And I think, the more you practice, the better things get. And the more, well, in some ways you get certain biases, like you like to work a certain way. Um, but half the challenge is challenging yourself to be able to expand your repertoire or refine it, or just to take a look back at what you're doing, and even having a look at things that we thought in our minds that acted a certain way, or certain doctrines, whether or not they're still the right thing all these years later. I think the students are really good at challenging me for that.
We
And
tried.
oh, I know, it's good. It's good. And sometimes I'll go in and I'll see a student doing something and I'll be like, oh, I hadn't thought about doing that. That looks like fun. So I go off and give it a try. Or there's certain techniques that I may prefer for certain areas of the body. And we then have to go and demonstrate a whole plethora of different techniques. And then I have to go away and reread and relearn and refresh. Normally it's not necessarily the technique itself, it's how I explain it and the what wording you use. But that then changes, because what suited me, when I was back in my 20s, now doesn't suit me as well as in my 30s. you
Yeah.
know Dealing with a bump, that as well, that changes life.
I was
That
just going to
changes how you
say,
work.
we're okay to say that you're expecting your first child,
Yeah, yeah.
and that's really exciting in itself.
Oh yeah, it is. It is. I'm so excited for this chapter. Um, but also quite apprehensive about what life is going to bring, because with COVID, found out we were pregnant, relocated across the country. So I haven't been practicing for a little while, which is the longest I've been without seeing patients in the whole time I've practiced, and even before practicing in private practice. So it's always a bit daunting, but I don't think you can unlearn 12 years worth of practice.
Definitely not.
Yeah.
And so let's touch upon that a bit. So,
Yeah.
you said this is the longest break you've had from not treating. What's that been like for you?
So weird. So weird. In some ways, it's nice to give my body a break, but it's still growing a baby. So it's not really had that much of a break. Um, but at the same time, I've really missed the social side, because a lot of what I love about working with patients is actually talking to them and finding out their individual story and getting to know them. I'm a really nosy person in some ways, and I really like to um, actually just talk to people. And by talking to people, you can really find out um, better ways, I think, sometimes, of how to tailor their treatment or how to tailor their rehab. I'm not the best at prescribing exercises, but if I know somebody likes to do a particular sport, or they like to do a particular thing, then it makes life a bit easier than going, oh well, go off and do, some knee extensions or do some bicep curls. I mean, how boring is that?
Yeah, I know what you mean. And so it sounds like it's more the interaction with not just the patients but your colleagues as well that you tend to miss when you don't necessarily treat. And I imagine that'll
Yeah.
be other people would have identified with that, especially if they've not practiced over lockdown and over this whole period of COVID.
It's been quite a roller coaster, I think, for everyone. I've been watching the forums, and there's been a lot of uncertainty, because I think there's just uncertainty in general. The IO's been doing a great job at sort of keeping us going, and also giving advice and liaising with Public Health England, and really giving us guidelines what to and not to do. But it was really quite scary, being pregnant during lockdown and not knowing. It was only after sort of lockdown was easing that they started saying, okay, well, it's only really in your third trimester that you start to become a medium risk, because they were talking about us being high risk. And then there was no indication as to whether or not it would affect the baby, but and I had all the family being a bit worried about being patient facing. So it's been quite an interesting few months.
Yeah. And one of the things you said earlier was that when you worked at a chiropractic clinic,
Mm,
they were a lot more business minded than maybe, um, well, I know I certainly am not.
yeah.
Why do you think there is that disparity between sort of osteopathic students emerging and graduating with the level of business mind or the business training versus maybe a chiropractor?
I think they do get a lot more mentoring in terms of how to run a business than we do. I know when did it all those years ago that we maybe had one module um, on how to run a business. I have done some training since. Part of my master's degree was business management and practice management, and doing extra courses as well. I am very much patient focused, and I'm more happy not necessarily thinking about my finances. I kind of think they'll follow. They'll follow as long as I'm doing a good enough job and I'm, seeing patients. And I don't necessarily think about how many times I'm going to get somebody in, or um, I just like to work with people until, while it's making a difference. If it's not making a difference, then maybe either they need a different approach, or they need to get something investigated. I've never really been financially driven, if that makes sense.
And I think that'll resonate with so many people listening or watching is
Mm.
we tend to be patient focused, and
Mm.
that's your driving factor. Not that it isn't for other people, but
No, no.
you don't think, okay, I need to see X amount of patients this day in order to cover these costs, in order then to
Yeah.
progress into something else or invest back into the company. Because I
Well,
never really thought about that.
mind you, that is something that I found helpful doing the degree. Is we had to sit down and do a cash flow analysis. So I worked out how many patients I need to see in order to cover, like, to cover my mortgage or my rent and food and geosk, and roughly how many I'd need to break even in a week, and
Mhm.
versus how many I'd need to see to make a decent living. And it was quite interesting, that thinking about it, because it gave me a bit of freedom, because they got to a point where I was like, okay, so I need to see X number of patients a week, which was, it wasn't as high as I thought it was going to be.
Okay.
Luckily, I'm quite a frugal person in my private life, um, and once I got past that threshold, I could go, okay, well, actually, I can kind of relax now, because every patient I see now is because I want to be here and because it's a bonus,
Mm.
and actually that was a really nice way to feel about it, rather than going, oh my god, oh my god, am I going to break even?
Yeah, and especially for new graduates coming in, or recent graduates, I know that's definitely a worry that we had, or they have. Is you spent 4 years doing this degree, which in itself is it's hard. It's not an easy thing, and then you graduate and you think,
Mhm.
I've paid my dues, I've done the work, I'm going to go out there, and sometimes it's really hard.
Oh god, yeah, I mean, it's been my personal and work life has kind of been a bit of one of those weird things, because we graduated in 2008, which was just before the financial crash.
Oh,
So the first financial, so I was graduated in like the July, started work in the August, and then the finances started going sort of bit tits up not long after, didn't it?
yeah.
And then when I finished my master's degree, it was Brexit. And got a mortgage. So and now I'm having a baby and it's COVID. So I obviously pick my moments. But
I'm-
it teaches you a bit of resilience, doesn't it? And I like the fact that there are a few opportunities, like I remember listening back to Beth's podcast a few weeks ago and thinking, God, I'm glad that she's in like a employed position, because that means that then she doesn't have to worry about that financial side either, you know, and she can get on with treating patients and learning and developing, and that must be a comfort. I mean, there's plus sides and downsides to being employed and self-employed. There's always pluses and minuses.
yeah.
There's a bit of
And
a blur in our sorry, pregnancy. There are blurred lines, I think, in some practices between the difference between somebody who's self-employed and employed. Um, and I'm in a way I'm kind of glad listening to some of the younger practitioners, how and watching some of the younger practitioners who I've worked with, how much more they stick up for themselves, which I love. I love.
yeah. And it didn't strike me until I think I was having lunch with a couple of friends. This is before the rule of six came back in. It's fine.
Yeah.
Um, and one thing that struck me was one, how strong a group, and they're all people I graduated with, all osteopaths,
Yeah.
and how strong and resilient they all were. Because we were talking about sort of the jobs that we had taken and, what we had expected and what didn't go to plan and what did. And what struck me was, as a group, we weren't willing to not compromise, because that's not the right word, but willing to sacrifice in
Mm.
order to please an employer or go with the flow. It's, this is the agreement that we made. This is what I'm doing, and this is what you have to do in return.
Mm. It's a double-edged sword, isn't it? It's a double-edged sword. I do believe in good faith, and I work a lot in good faith. Um, but there does have to be there has to be that two-way good faith, if
Yeah.
that makes sense.
Yeah. And it's not to say that every practice
Oh God,
out
no.
there isn't. There are really great practices out there.
Oh yeah, and there are some very, very good head of practices. Really good, really good.
Yeah, I think it sometimes just takes, at least it took me a while to figure all that out.
Yeah, and I think sometimes even if you're finding the environment challenging, there's always something that you can learn from it.
Yeah.
So even if you're learning that's not the environment that I want to be in permanently, then I still think that's an important lesson. And
Mm.
turning around to yourself and saying, well, why doesn't that work for me? What is it that I'm looking for? Um, and actually, is that me, or is that something within the system that needs to change? Is that like systemic within the profession? Is that systemic within this particular business? Is this something we can change together? I think
And
that's just
that's,
a life lesson, really, isn't it?
yeah, preach. And that's such a testament to who you are, I think, as a person. You've always come across as such a positive, sort of glass half full, optimistic, and just open type of tutor when I was a student.
Thank you.
Um, and I remember particularly when we're in clinic, and we finished clinic. It's the end of um, that evening or whatever, and we're tired. We're all hungry. We're all tired. We all just want to rip off our tunics and go home. And I think you were one of the few tutors, if not the only one, who sat us down whilst we were like finishing up notes and getting our notes signed, and just asking
Mm.
us to reflect on that clinic session.
Yeah, not everybody likes that, you know.
The psychology in me loved it.
Yeah, yeah, yeah. I try and phrase that quite distinctly in terms of not just trying to think about the negative. So my favorite questions at the end of a clinic day is, so what what have you learned from today, and what have you done really well? Um, it doesn't have to be in that order. And I think sometimes students don't like reflecting as part of the group because they kind of feel like they're revealing their weaknesses, or I don't know. But I kind of think if one person's learning a lesson, everybody else is going to have learnt that lesson or will do somewhere along the line. It's not a place of judgment. I don't do it to judge people. But I find it equally interesting if people can't actually think about what they've done well. I actually find that more disconcerting when a student can't see what a positive thing for the day. Um,
And
so.
you get, I remember the first few times you asked, and it was so hard for me to be able to say something because positive, because you're always so easy to go on the critique
I
and
am
say,
too.
well, I forgot how to do my cranial nerve testing, or I didn't, yeah, just perform this technique correctly. My hands were in the wrong position. My body wasn't anchored, and all that kind of stuff. And then to be asked, okay, what did you do well? And you just think, what? And the
Mm.
first couple of times I thought, she's a bit crazy, right? Like, this can't be for real. Like, what's going on? But in a lovely way, because I thought no one's asking this of us.
Oh, I'm surprised. I'm surprised, and I'm kind of glad to hear the positive feedback about it. Thank you.
Yeah. And so where did that come from for you?
Oh, I think that came from doing the PG Cert ACE at BSO, now UK.
Mhm.
Um, so that was one of the things we had to do for critical reflection. So we had to do it ourselves at the end of when we were doing teaching. So I thought, why not bring it to you guys? Because it's supposed to be reflective practitioners, especially with the new GOSC regs. So why not get you thinking about it? And why not actually, in the fourth year, you've got so much going on. Like, we all know it. We all, I'm not there to pile more stuff on top of you, but it does you good to actually see the positives every now and again, rather than going, oh, I'm just rubbish at doing everything. I've got this essay, I've got that essay, I've got this patient, and I have no idea what to do with them.
Yeah.
Or I've got this thing going on in my personal life.
And do you take some of that sort of questioning into private practice?
What, of myself
Yeah.
or of colleagues? I
Of
try
yourself.
to. I try to. So, especially if there's like a critical incident, not that that happens very often, but or if there's like a moment where I feel I could have done better, or like I'm missing something and I'm going and asking a colleague, it's like, okay, so was I along the right lines there?
Yeah.
Yeah,
And
it's
it's
nice to give people positive feedback. I think uh, there's people are so quick to criticize and so slow to compliment. It's just
absolutely,
human nature.
yeah. Unfortunately, though, but and it wasn't until I was doing my sort of my prep work for this interview today, or
Yeah.
this podcast recording, where I was like, okay, what are my favorite memories of Louise? And that popped up, and then
Oh,
I started actually doing it at the end of each of my working day in this week.
yeah,
And it was interesting because I sat there and I was like, what did I like about this session or today? And I was
yeah,
like, okay, wasn't a whole lot today, but that's okay. Tomorrow will be better.
yeah, yeah.
And it
Or
was.
it's like, I actually, you get home sometimes and it can be very tiring, especially if emotionally tiring, to be with somebody for half an hour and just be really present. Especially if people have got, you know, intense personal situations going on. And sometimes it's actually nice to go, okay, well, I was able to support that person, or, you know, I was able to make, I think, make a difference there. Um, yeah,
Yeah. And does that influence your ethos to practice?
I hope so. I hope so. Yeah, I try not to take criticism too much to heart, uh, but I do take it very personally. But I try not to be so soaked in it that I can't see a way out.
Yeah.
Otherwise, I think I'd have quit years ago. Years ago.
Yeah. Yeah. And I suppose as a student, only because I've been there, recently in that position,
Mm.
you don't live for, but you're always seeking that external validation from an essay, a grade from an essay, or your dissertation, or a form A from a tutor. And so you're almost conditioned to want feedback, but
Yeah,
also expect negative feedback so that you can do better.
yeah. Or you can use it to beat yourself up with. Some people just enjoy beating themselves up with these kind of things. Sorry
Yeah.
to say it. Yeah, I know the feeling. And, and then you get into private practice and it's your head of practice or your colleagues and, their um, input becomes very important. And I think sometimes it's easy to forget that as somebody who's been in practice for a while. And I always think I've been glad to actually be that person that can go, okay, well, okay, so this didn't work. Have you looked at it from that perspective or this perspective? Or, oh, don't worry, they're just having a bad day. Just go off and, come back, have a breather, come back and we'll go through it and we'll try and work out how we can do it better next time.
Yeah. And for me,
Yeah.
having sort of colleagues around me in order to just vent at, literally, was the one thing that saved me from just
Yeah.
quitting my job.
Yeah. Yeah.
Um,
Yeah.
how important was it to have, people around you to be able to talk to about those kinds of things?
Oh, so important, so important. And, that's where, the social side of being a student really helped. When I first graduated, I was living in Essex and my best friend was like 45 minutes drive away, which was wicked. So when you're a poor student or new graduate and you can't necessarily afford to go to all the courses that you want to do, just being able to meet up with a friend for a cup of coffee and go, just kind of say, okay, well, this is going on and this is going on. And, you know, I had this patient coming in with, oh my God, this all together weird presentation. What do you think? And at the time, my best friend, she went off and did the course at the OCC, so the Osteopathic Centre for Children. So she's wicked when it comes to anything pediatrics. I think she's magic.
And a
So
good person to learn from, because you've
mm.
also embarked on the pediatric route as well yourself.
Yeah, I think it's a start for me. I mean, our pediatric course kind of fell apart when we were at BCom because I think it was just, I don't know what happened, but um, we were supposed to have people coming in, external people that just weren't, and then we ended up with a tutor, Andy Maddock, lovely guy, coming in and basically cramming a year's worth of pediatrics into a term or a term and a half,
Wow.
which is intense in fourth year, like intense. Um, and so I never really felt like I had the time to kind of unpack some of the skills. I was already a little bit sort of nervous about handling babies and having them scream at me. It's a bit late now to undo what I've done. Um, but it's just kind of one of those things. And I was always a bit sort of tentative about um, doing it on my own, if that makes sense. So taking a baby, I was always afraid that I was going to miss something. So when I was working in Essex, I just used to ferry them all to my friend, be like, oh my God, go and see this person. She's magic. She's my osteopath. She fixes me. Um, she's still my osteopath. She, one of my osteopaths, I should say. But she's just yeah, I still think magic. Um, and so, or when I worked in a big group practice in Suffolk, the guy that I worked for was really into paediatrics, and one of my other colleagues was a tutor at the OCC. So again, I just kind of go see them, go see them. They're like experts. They're much better than me. And it was when because I used to work with Sebastian at Beacon as a tutor, and I still work with the new paediatrics guy at Beacon on a Monday afternoon. But Sebastian was starting his paediatrics course, and I went, okay, actually, you know what? It's a year. It's a year's course. He's really good. He makes me feel very comfortable. Always has done. Such a kind soul, actually. Um, I think the time's right. So that was December last year. And by God, it's pushed my cranial skills.
Wow.
It's pushed my, when we were still allowed to practice, um, it's, it's pushed my knowledge skills again. You're never too old to learn or too far into the profession to learn something new.
And so what shifted for you from, referring all these babies to your colleagues to being, actually, this is something that I want to be able to do. These are
Yeah.
patients I want to be able to treat.
Well, how long can you keep putting it off? How long could I keep putting it off? Especially, over the years I've treated pregnant ladies who've then tried to bring their babies to me, and I'm like, no. And when I should have been going, yes, bring them all in, bring them all in. Because as osteopaths, technically, we can treat pregnant ladies or within guidelines, within restrictions, and we are technically, uh, we're technically trained to treat babies, but I just think they have completely different needs to an adult. They're a completely different patient set. And it's nice to be able to work with little people. They're great fun.
Yeah.
They're great fun. They bring such energy into a practice.
Yeah. And so obviously I had Sebastian De Rocha as a tutor when I was doing my fourth year at
You lucky
BCom.
thing.
Yeah, so knowledgeable, just incredible amounts of knowledge. And you just have to keep up because he was on to the next thing by the time you're processing the last thing he said. He's just so quick as well.
Yep, yep.
Um, and so doing the course with him, what have you gotten out of it that you feel that cemented sort of that treatment modality or that treatment for babies and young children?
Oh, he's just so chill. He's just so chilled out. And when he comes and sees all these babies, it's like, he just kind of walks in the room and everything seems to be okay. Does that make sense? Um,
Absolutely.
but he's also very patient when it comes to teaching. So with the lockdown, we've been doing a lot of online seminars. So we haven't stopped learning. We just haven't been able to do it in practice, which is a bit annoying because, it's none of our fault, but it's very difficult to be actually putting your hands practically on a baby or practicing cranial or whatever without actually being there.
Hmm.
Theory can only take you so far.
Yeah.
So I'm looking forward to getting back to that eventually. He's allowing me a bit of maternity leave, which is nice.
Well, he just had the same situation himself. So,
Yeah.
yeah.
Oh, very happy for him.
Yeah. And so, one of the things that when I was looking into, doing a postgraduate pediatric course was just how much cranial was involved in it. And so, I did the observations at the OCC and
Yeah,
at BSO or UCO now.
yeah.
And they all treated so differently.
Everyone has a different perspective,
Yeah.
and just because they're a child doesn't mean the only way you're going to treat them is cranially. It's a great tool, and it's a very useful tool, but it's not the only tool. Um, so I still mobilize. and do massage or whatever a child needs.
Hmm.
You just have to modify it. I mean, God, it's very different mobilizing a 3-year-old spine to mobilizing, say, a 20 or 30-year-old bodybuilder. You just have to modify what you're doing.
Yeah. And so, how much cranial do you bring into your practice with pediatrics?
Um, I'm lucky. I started doing some cranial in my first year postgrad. I went off and did the um, BSO UCO course, which I found very helpful, sort of going on from the um, BCom qualification. And I've kind of built it from there. One of the guys that I worked with in Suffolk, again, is very, very proficient at cranial. And I learned a lot from him and reading books and sort of working with different patient groups. I think a lot of it is based on cranial, um, but you can't forget your technical structural skills. I do think that another colleague said all techniques, whether they're cranial, they're visceral, they're classical, or using an HVT, they're all structural techniques, whether or not they're working directly or indirectly. So they're all osteopathy. I don't like saying I'm a cranial osteopath or I'm a visceral osteopath. I'm an osteopath.
And how powerful is that to be able to say, you're an
Yeah,
osteopath, but you embody all these different kinds of things?
yeah. I mean, it's wonderful when you're working with a patient and you go, okay, well, this obviously isn't working. Shall we try something else? It takes a bit of not always convincing, but it takes a bit of confidence in your practitioner to be able to go, okay, well, we'll try something different. Um, and not everybody's the same.
Yeah.
Yeah.
And so
The
for
only
anyone,
problem
sorry, go
the only
ahead.
problem is though that then when you start with a normal career, you get career progression. So you'll come in and say, "Oh, I'm a junior this, and then I'm a this, and then I'm a senior this, and then a director." There's once you qualify as an osteopath, you are an osteopath. There's no kind of there's no distinction, which is again, I said before, a double-edged sword.
Yeah, it's interesting because I was having this conversation a couple of months ago with somebody that not I had somebody that I know who's an osteopath, and we were having the exact same conversation about how
Mm.
you know there's no physical sort of progression levels in private practice.
Mm.
And if he's listening, he'll know exactly what I'm talking about, and he'll probably be able to explain it so much better than I can. But I remember I was struggling at the time because I am in an employed position
Yeah,
in a very large institution, and and you do wonder, like, would I be better off in private practice? And he was just so able to break things down for me in the way that in private practice there are no tiers essentially. So as you progress, you develop your knowledge, you develop your own style, you learn from others, but the most
yeah,
negotiation you might have is to negotiate your percentage.
yeah, yeah.
Whereas where I am here and where I'm working here, it's a bit different. There are progressions, like there are things that you can work up towards, and so
Mm.
it presents its own challenges, definitely, but its own advantages at the same time.
What you tend to find is that you tend to work in a slightly different way, or you have different qualifications. So you might find in a big group practice that somebody goes, okay, well, that person works better in this way or that style, and tend to funnel patients, one way or another way, which relies on having a good front of house system and somebody to triage on the telephone. It also is that becomes problematic because then that you only end up seeing a certain demographic of patient. So I don't know. There was a great saying when we were students: if all you see is hammers, or if the only thing in your toolbox is a hammer, the only thing you'll see is nails. So
I love that.
yeah.
Yeah. And so do you have a type of patient that gets funneled to you or that is sort of directed to you?
I don't know, really. I've never really sat and thought about it. I have had particularly diverse patient lists over the years. Working as an only osteopath presents some challenges, and working within a group practice that's been around for quite some time, it does tend to attract people from the local areas. And so sometimes you'll get people coming in who haven't seen their GP yet. You're going, oh, this isn't quite right. Or, I've had some patients with unusual pathologies or, just as a diagnosis. Um, I quite enjoy a challenge. Um, Not that a patient's a challenge,
Mhm.
the challenge of working out how best to help them. You can't always fix everything. That was something I had to learn for myself, quite early on. You can't fix, if you think you're going to go in and fix everything or fix everyone, then you're in hiding for nothing, really.
What a humbling thing to say, though. Because when you graduate, you think, I know all this stuff, I know all these techniques, and I've done all my pharmacology, my pathology. I'm
Yeah.
just going to go in and I'm just going to, you know, fix everyone.
Yeah. Because I am champion of the world.
Yeah.
Yeah. But in family practice, I mean, I could have, say, a 90-year-old come in one appointment, maybe 10:30, coming in with a shoulder problem. And, you know, I'm trying to think back a few years to a particular patient where they were 90, living on their own, and our goals of treatment were to be able to give them enough shoulder movement to hang things on the washing line and to get cans out of the cupboard. Yeah. Next patient comes in is a semi-professional dancer, shoulder problem. Their goals are to be able to literally lift somebody over the top of their head. So completely different expectations.
Yeah.
And I think actually going on postgrad courses and things like that, actually one of the things we need to manage ourselves is our own expectations of what we're going to manage in the course of treatment, and also what our patients expect of us, and then what our head of practice expects of us.
And yeah. So it's
What
almost like you're juggling all these different expectations at the same time.
isn't that life?
Yeah.
Again, you have that as a child, you have that as a as a person, as somebody within a family unit, or as a friend. We have all these expectations, and I think sometimes it's easy to forget when we get lost in our own expectations of ourselves. Took me a long time to learn that one.
I'm still learning that.
Yeah, I know it in theory. It's working. It's putting it into practice that I'm still working on.
Yeah. And I think definitely working with patients, and especially at the moment over sort of over the telephone, is it's really hard to get a sense of what a patient's expectations are and how to match that accordingly.
Oh yeah, and if somebody's really intelligent and has done any kind of interviewing as well, they know exactly what you're asking of them and can work their way around it.
Absolutely. I've been accused of not accused, but I've been told, like, I know what like exactly what you said. They said, I know what you're asking from me, but that's
Yeah,
not what it is. And it threw me.
yeah. And
I
I tend to then throw it around and go, okay, so what do you think is going on? And what do you, so if it's not where what I'm asking you, what do you think it is? Or um, say when you're doing an interview, I mean that interview phase of an appointment. So somebody comes in for an appointment, you sit, you talk to them. If it's a new patient, you're going through their case history. If they're a returning patient, you ask them, well, what's brought you back? Is it the same problem? How's it been? How did you find the treatment last time? It's sometimes, and you'll be asking difficult questions like, or asking about somebody's, I don't know, their intimate life, or you'll be asking them about their bowel habits. And it's not something people expect to be asked about in an osteopath appointment. But there are certain things, particularly if we look at, say, low back pain. Um, for me, it's a fairly standard thing to ask. If somebody's coming in with acute back pain, what are your bowel and bladder behaving normally? Are you getting any change in sensation around your sort of genitalia and back passage? Are you getting all of this? And the reason is because we're screening for neurological compression, and you're screening to see whether or not there's actually an active compression, because the implications of missing that can be life changing. But if a patient doesn't know, that's what you're asking, and they think, oh God, I'm just coming in with back pain. Why are you asking me all of these questions? And there's been a few times, particularly when you have only a short time frame to get that information out of somebody. I go, okay, look, the reason why I'm asking you is not because I want to know the ins and outs of your bowels. I just want to know that they're functioning. And, sometimes just turning it around and being blunt and actually um, just explaining your reasoning behind asking and behind taking a certain line of questioning actually can turn somebody's expectations around quite quickly. Especially, yeah, that's where I was trying to say.
yeah.
Yeah.
And so, is there anything that you would have had liked to have known, or anything that you'd like to have told yourself when you graduated? Something that you think that would have been good to know, or that's some good advice?
Be kinder to yourself. I think that's just a life one. Just be kinder to yourself, and just, not everything's going to work out how you think it is, but actually sometimes the things that you really don't expect are going to be glorious. Yeah.
Yeah. And you also spoke about cranial, and I mean, you've done some cranial work on me, and it's been
Yeah.
amazing.
Oh,
Um,
thank you.
yeah, definitely.
I don't think I'm the expert. I don't think I'm like, ah. I know people who are. Um, my friend who did the OCC courses, um, but you know, again, that's a work in progress. You keep learning.
Yeah, and
Seb
so
is really good as well.
yeah, yeah. I remember him walking into a room just holding the baby. The baby would just stop crying, and I'm like, wait, hang on a minute.
Whereas I've had one where the baby was crying for like 20 minutes straight, and he was still so calm at the end of it, and inside my whole like being was vibrating, and he just was like still so calm.
But for anyone who wants to learn more about cranial, or wants to start that practice or start learning about it, what would you tell them to do? Where would you tell them to go?
Um, so there are a few places to go. So I did a course years ago at at UCO, which was quite good, because UCO, they are quite sort of structural, and they're like, this is this and this is that and this is this. There's also the Sutherland Cranial College, and they're very good actually. They have lots of different practitioners, and they run almost cycles of courses from different aspects of cranial osteopathy. You can go to places like the Osteopathic Centre for Children, which is sort of more geared towards sort of learning and doing a formal qualification in paediatrics, as is the UCO and LCPO. It's kind of fun being in that first year of Sebastian's course.
Yeah.
Um,
You're the elders, you're the first ones.
I know, and it's such a fun group actually. They're a really nice group.
And it's a small group. That's not what
Yeah,
I imagined. It's a really nice, small, intimate group.
yeah.
I mean, I'm
They're
talking as
great.
if I'm on it. I'm not. I've just been watching you this whole time.
Well, you should have joined us. You will
I
next
know.
year, I hope.
Fingers crossed. Yeah.
Yay. Because
Yeah.
I think I'm going to overlap onto that second year because of all the other stuff. I
Which
must admit, it was really. I had a moment during the pregnancy where I was just waiting to have my oh, was it my anomaly scan? So that's a 20-week scan, and I was writing a case report about a child with congenital abnormalities, and I was like, oh my god, oh my god,
oh,
oh my god. Uh, no, life is good.
it's fine. It's fine.
No
It's just an
congenital
essay.
abnormalities.
And so, speaking of your pregnancy, then, like,
Yeah,
because obviously you know you've gone throughout your pregnancy in a very, very strange time.
yeah,
Um, how has, even putting that aside,
yeah.
how has pregnancy changed the way you would practice or you would have practiced?
I think it probably would have changed how I did certain techniques. Recognizing that I'm not Superwoman, that I already have an underlying very mild hypermobility issue anyway, and so there are certain techniques in pregnancy that you really aren't as conducive to looking after my own body. Um, yeah, and doing it during a pandemic is also very strange. It's very strange working in masks. It's doable,
Mhm.
it's perfectly doable working with masks and gloves and aprons and things like that. It's just very strange having a big belly getting in the way, you know. But I have comfort. I had a colleague in my multidisciplinary practice who I looked up to, who worked up until 39 weeks of pregnancy.
Wow.
Yeah, she was unbelievable, unbelievable in a good way.
Yeah. I mean, I'm tired on regular days. I can't imagine trying to grow
Uh,
another human being inside me and do everything that I'm doing.
it's not necessarily the growing the human being, it's the insomnia.
Oh
Not being
gosh,
able
yeah.
to switch the brain off.
And so for you, like, what do you want? How do you see, I suppose, your practice developing over the next 5 years, for example?
I'm at a crossroads. So either I can go back into a system that I've worked in before and I know very well. I'm happy to carry on teaching if they'll have me, which I've
I'm sure
been
they
told
would.
they'll have me back. Um, and or do I go back into working as an associate? Do I start my own venture? It's all up in the air at the moment, but also at the same time, I'm just looking forward to meeting this little human being.
Yeah. So it sounds like there's loads of exciting things coming through.
Oh God, yeah, never a dull moment.
Yeah. And so, what would you like from? You talked about the system before, so I assume you mean the osteopathic sort of profession.
Mm.
What would you like to see from the profession in terms of growth or change in the next 5 years?
That's a really tricky question.
Yeah, I didn't prep you for that one. I'm sorry.
It's all right. There's so much good out there. There's so much good out there. And I think just remaining inclusive and being there for one another and supporting one another, um, and maybe it would be nice to be a bit more recognized outside of the profession. Maybe you know, there's a lot of politics going on. There's always a lot of politics going on, and I'm not a politician by any stretch of the imagination. Um, but just driving and pushing forward more. If more research is being done, then that's brilliant.
Yeah.
Um, to be able to say more things, because there's so many wonderful things we can do as an osteopath that you can't necessarily say without getting yourself into a whole heap of trouble. Um, and yes, I was around during all of that big upheaval as well. Um, and just maybe sort of reducing some of that stress. Um, you know, being able to be more open again. Again, I don't know if that's the right thing to say or not.
It's the truth, right? And
Yeah.
especially with in terms of research, it's I think it's really important because I come from a research background, and I know you've got the NCO who do a lot of osteopathic.
Oh, yeah, Carol
Mm,
Fawkes is amazing.
yeah, and they're really spearheading that. But I feel like in comparison to other professions, we don't have as much research going on. Whether it's because of funding or just
Well,
people.
there's the difficulty is we're all in private practice. The vast majority of us are self-employed. So if you've got somebody that's going out and doing research, it's off your own back in your own time, and it's often costly, timely, time consuming, and you know, we're not necessarily as a profession great at doing research that's going to be publishable.
Mm,
Um, and I think a lot of us kind of like to go out and do our own thing, but don't necessarily come together to do that research side. Or there's research is a funny thing. I think there are, how do I put this? How do I put this succinctly? Science and research is great at asking questions. I don't necessarily think that we've got the tools yet to measure and to quantify the answers, if that makes sense,
yeah.
or the right ways in which to frame the question. Because sham treatments, I mean, some of the ways in which we'd research, I'm not sure would fit into the framework of how we practice. I'm not sure the best way how to double blind study. Mind you, I'm not a great researcher. We have some amazing researchers in osteopathy. We've got IJOM, we've got the team doing research at BCom and pushing that forward. We've got the team at UCO. So I did my master's degree there, and the research team was epic, and really pushing forward. We, like you said, we've got NCORE, um, but we haven't necessarily got. Yeah, I don't think we've quite worked out how to do it yet.
No, and one
It's
thing
coming.
that comes across from when I'm working with physiotherapists is how much of their practice is evidence-based.
Yeah,
And that's not to say that ours isn't, but
yeah.
we know there are so many things that we do well and we do really well, but
Mm.
we can't turn around and say this is evidence-based.
I think there's a difference between evidence-based and evidence-informed
Okay, what's the
as
difference?
well. So there's a mixture between clinical judgment, and having worked and seen things before, and whether or not it says so strictly in literature. So if a piece of literature says that you have to do an exercise or you do something in a very prescriptive way, whereas evidence informed, you're kind of reading the research, you're collating, and you're actually then forming a judgment and really sort of sitting and digesting. Does
I
that
like
kind of make sense?
Yeah, I like that. And especially for people who aren't aware of all the research that does go into it.
There's always
Um,
research to read.
oh, yeah.
It's always something. I'm marrying a researcher. It's not a researcher in osteopathy, but in a different field. And there's always something new, there's always something to read. And it's like, when you read the papers and they say, oh, 1 week tomatoes are good for you, and then the next week, oh no, don't touch a tomato, it'll kill you. you know it's you just got to read it and sometimes take it with a pinch of salt, or really read between the lines.
Yeah.
That was one of the great things the masters did for me. you know
And what are the things that you're reading at the moment that you're finding really interesting or really powerful or informative?
with a baby imminent, I've kind of slowed down on that research. But I was doing a lot of pediatric research for this course that I'm doing, particularly with sort of case-based studies, and learning about different conditions that can um, affect children, affect pregnant women, that are happening in private. Yeah, could just walk into your practice.
Hmm.
Um, Sometimes it's difficult not to overanalyze my own situation, but then I think that's another thing with osteopaths, who I think you go through a phase where you're like, "Oh my god, I've got this thing going on." "Oh my god, I've got this pathology. My foot's gonna drop off." And then you go through a phase where you're just like, "Nah,
You'll be all right.
oh, everything's all right, even if your foot is dropping off." You know? And then you get to a pragmatic stage. There's always there's that kind of fluctuation.
I think you just described the entire year we did pathology and diagnosis with Dr. Wassal, where I was convinced I had every single medical condition he was talking about.
Oh, yeah. Oh, yeah.
And you almost talk yourself into it. It's like, yeah, I have a headache. Oh, wait, do I
Yeah.
have a brain tumor? You don't have a brain tumor. Stop it.
Yeah, yeah, yeah. I think the hardest one is, like, thyroid, because there's, like, so many different symptoms. You're just like, "Oh my god. Oh my god, have I got underactive? Have I got overactive?"
I've been gaining weight during lockdown. Things aren't going great. I'm tired all the time.
Yeah. I'm My hair is coming out because 'cause I'm pulling it out now. Sorry,
Absolutely.
naughty sense of humor.
No, I love it. And that's what makes you so uniquely you. And that's what I really enjoyed about having you as a student in clinic is, it's that sense of humor comes across, and that optimism definitely comes across, and you
Mm.
feel safe.
Aw, I'm glad to hear that. I'm
Yeah.
glad to hear that. Like, because I think sometimes students don't like it when I come in and talk, or they don't necessarily get that I'm having a joke. Because I do quite a good straight face.
You have a good poker face. I was gonna say, how was that translated for you in clinic, being able to start articulate to different people, different types of people?
I think you just do it. It's like when you are talking to somebody. I mean, I don't. You don't talk to a younger sibling the same way you talk to your mum, or you don't talk to an older person the same you do a 5-year-old. It's you just end up adapting, and sometimes you rephrase the same thing 4, 5, 6 times. Um, and I think sometimes the students in particular get very frustrated with this when I go in and I'll be asking the same question, but just in several different ways, because sometimes I'm just like, does the patient actually understand what I'm saying? Or I don't think I've got the full answer here.
Hmm.
Yeah, I'm also a little bit sneaky, so sometimes I'll be chatting to patients and getting information out, and in kind of a more relaxed way. So
And I remember that firsthand. I remember treating a patient, and you were just talking to them, and I'm just thinking, "Oh, thank God, I can just carry on with the treatment." And then you brought it back, and you're like, "Did you pick up on this and this?" And I was like, "Wait, that's why you were asking them the questions?"
yeah, yeah, yeah.
So
I
yeah,
mean,
you.
some students really hate that, because I've had the comment that, I think I had the comment that, you're not there to build a relationship with my patient, which I found particularly difficult. Um,
Mm.
but because that's just how I am in as a person. Um, But at the same time, I've been in before where I've walked in and there was something underlying. The tone was slightly off, and it turned out the particular patient had been bereaved. In fact, this has happened more than once, um, mm, fairly recently, and it hasn't come up in conversation. And whether or not, I think sometimes patients will see a tutor in a different way, and they will definitely act differently when a tutor's in. I remember that from being a student myself. But sometimes it's also being there with a student to actually deal with a person who is in that stage of grief, and actually realizing how much of an impact that can have. Or, sometimes the patients will be more open with us than they will be with their student. And I never
Absolutely.
take that out on a student.
Yeah, it's a learning experience, and that's part of the journey in a way.
Each patient experience is a learning experience,
Yeah, even when you finish and you're just working in private practice.
especially when you're in private practice, because sometimes it's just having ideas reinforced. Sometimes it is, or you're learning different ways to approach the same problem,
Yeah,
or you're having to learn independence, which is massive in your first year of practice. It's
and
such a steep
scary.
learning curve, your first 18 months.
Oh my gosh, I remember just being
Yeah.
scared all the time.
Yeah, yeah.
Like I'm in a room alone with a patient and I don't have anyone I can call.
Yeah.
Like, what if I make a mistake? And you're not going to, because you've been trained well to, rule out
Yeah.
all your red flags and everything. But
But I think you shouldn't have that. If you're working in a group practice, you should be always you shouldn't have that reticence to call somebody in. Like, I remember calling my head of practice in a couple of years ago because I had a patient come in with an unusual rash. And I thought, oh, it looks like this, but it can't be this, And I got them in, and it was exactly what I thought it was. And I think the patient had shingles. And I was like, oh, that is communicable. Um, they haven't seen the doctor yet. Let's get them to go see a doctor.
good catch. Yeah.
But it was just a slightly unusual presentation. Or even now when I'm in clinic and I've got other tutors going in. I think my last day in clinic when I was there, I got Dr. Wassell in on one of my students' patients because there was something going on. They hadn't gone to the doctor like I'd asked them very specifically to do. And I was like, right, okay, I know one of my colleagues is a doctor. Why not see if he can have a look and see what's going on?
Hmm. Yeah.
And sometimes being able and communicating that in front of students and seeing how we interact as colleagues is as important.
Yeah. Well, I've always appreciated the energy and the candor and just the sense of calmness you bring into clinic, not just as
Oh,
a lecturer or as a clinic tutor, but even just as a person when you come into a room.
thank you.
So, yeah, I've always appreciated, and that's something that I always think about and I try to emulate as best I can.
I
Um,
think you do. You do definitely. Even though sometimes we feel like a duck, we're like serene on the surface and paddling away like mad underneath.
Absolutely.
You know.
So, yeah, so I wanted to thank you and thank you for coming on and sharing all your experiences. I think it's just been wonderful having you just talk about, the pediatrics and the cranial side
Yeah.
and how all of that just shapes you and that you don't have to just stay stagnant in your practice.
How boring's that?
I know, right?
If you're in it for the long haul, you've got to be able to learn and adapt. Who wants to be doing the same thing that they learnt at uni, 20, 30, 40 years on?
Yeah, it's the foundation for a reason.
Yeah,
Yeah.
yeah. Thanks for having me. I'm sorry if I've yammered on a bit.
I've loved it.
Yeah.
We need to have just more conversations like this, so we just talk about Stowmarket and Barry and
Yeah.
Suffolk in general.
Yeah. No, I genuinely did love my time there, honestly.
Me too. And thank you so much for coming here today. And yeah, hopefully we'll see you very soon with a little bundle.
Yeah. I have to work out how to get up there. COVID
Or we'll
reliant.
come down. We'll come down.
Yeah. No, I'd love that. I'd love that.
Thanks, Louise.
Take care, honestly, and keep up the good work.
You too. Thank you so much.